How to treat recurrent dizziness. Recurrent dizziness can be caused by many things, from vestibular disorders, low blood pressure, anemia, to neurological or psychological problems. To treat it effectively, it is necessary to identify the specific cause and combine appropriate methods. 1. Identify the cause of dizziness. Vestibular disorders often cause dizziness, accompanied by nausea, loss of balance, especially when changing positions, such as BPPV, benign paroxysmal positional vertigo. Abnormal blood pressure. Low or high blood pressure can cause dizziness, lightheadedness. Anemia or hypoglycemia. Cerebral anemia or low blood sugar leads to dizziness, fatigue. Stress, anxiety. Chronic stress or anxiety disorders can cause psychological dizziness. Neurological disorders. For example, vestibular migraine, vestibular neuritis, or Meniere's disease. Medication side effects. Some medications, such as antibiotics, blood pressure medications, can cause dizziness. What to do? If dizziness recurs frequently, is severe, or is accompanied by symptoms such as loss of consciousness, difficulty speaking, or weakness in the arms or legs, see a neurologist or an ENT specialist for evaluation. Tests that may be needed. Blood pressure measurement, blood tests, CT MRI scan, or vestibular function test. 2. Treatments for recurrent vertigo. Depending on the cause, here are common treatments. Home treatment for mild cases. Change position properly. If you feel dizzy when standing up, stand up slowly, avoiding sudden changes in position. Perform the Epley maneuver, if diagnosed with BPPV, to adjust the position of the crystals in the inner ear. Instructions. 1. Sit in bed, turn your head 45 degrees toward the affected ear. 2. Lie down quickly, keep your head tilted, wait 30 seconds. 3. Turn your head 90 degrees to the opposite side, wait 30 seconds. 4. Roll onto that side, wait 30 seconds, then sit up. Note: should be instructed by a doctor the first time. Drink enough water. Dehydration can cause dizziness. Drink 1.52 liters of water day, supplement electrolytes if needed. Nutritional supplements. Eat foods rich in iron, red meat, green vegetables, and vitamin B12, fish, eggs, to improve anemia. Avoid skipping meals, especially if you are at risk of hypoglycemia. Deep breathing. Dioma. Practice slow breathing. Inhale for 4 seconds, hold for 7 seconds, exhale for 8 seconds to reduce dizziness caused by stress. Rest. Avoid bright lights, noise, or phone screens when dizzy. Lie down in a quiet place, with your head slightly elevated. Lifestyle changes. Get enough sleep, 7 to 8 hours per night. Avoid staying up late. Light exercise, yoga, walking, or balance exercises, such as standing on one leg, help improve circulation and vestibular function. Limit caffeine and alcohol. These substances can stimulate dizziness. Manage stress. Meditate, breathe, or engage in relaxing activities. Listen to music. Read. 3. When should you see a doctor immediately? Dizziness accompanied by severe headache, loss of vision, weakness in limbs, or difficulty speaking, suspected stroke. Dizziness that lasts more than a few days, recurs frequently, or is accompanied by tinnitus or hearing loss. History of head injury or underlying medical conditions, diabetes, cardiovascular disease. 4. Tips to quickly reduce dizziness when it occurs. Sit or lie down immediately to avoid falling. Look fixedly at a point on the wall to reduce the feeling of spinning. Drink a sip of cool water or eat a piece of candy to stabilize blood sugar. Gently massage the neck and shoulder area to improve blood circulation. Note: do not take medication on your own. Many dizziness medications have side effects or are not suitable for specific causes. Monitor symptoms. Record the time, frequency, and factors that trigger dizziness, eating, posture, stress, to provide information to your doctor. Consult a specialist. If dizziness recurs for a long time, your doctor may recommend methods such as surgery, rare, or intensive treatment. Thanks for watching the video. Wish you and your family health and happiness.